Pardon me, 8:14 and a half. Tommy Tucker, WWL. The forecast got pushed a little from yesterday. A 20% chance for showers today, highs of 64. Warms tomorrow, sunny, highs of 72. Chance for afternoon showers Thanksgiving Day, highs of 72. Black Friday, stormy at times, highs in the low to mid 70s. And then Saturday cools off, rain early, highs of 66. Sunday should be perfect for anything. Plenty of sunshine, highs of 70, not necessarily holiday-ish. According to Feeding Louisiana, roughly 1 in 5 people in Louisiana experience food insecurity, and that number's even higher for older adults. Dr. Brent Wallis joins us from People's Health. Talk about food insecurity and how you can help combat it this holiday season. Not Thursday, Dr. B, but we had to play with the calendar a little bit because it's a truncated week.
I know. It's good to be with you on a Tuesday.
And thank you for joining us, sir. What is food insecurity, Doc?
Yeah, so really the definition of food insecurity is, it's set by the U.S. Department of Agriculture, or the USDA, and what they describe it as is a lack of consistent access to enough food for an active and healthy life. And really, food insecurity is not just a measure of the amount of food you eat. It's really a measure of whether or not that food, makes up a good, healthy, high-quality, varied diet. And it's divided into 2 different categories. So there's low food security and very low food security. And so if you have low food security in your household, you probably have enough food to eat, but really your diet is, it's very consistent. It doesn't have much variety and consists of a lot of low-quality foods. If you're very low food security, then a lot of those households actually have disrupted eating patterns. They may have really small meals or even skipped meals at certain times.
Is there a difference between food insecurity and hunger?
Yeah, food insecurity really refers to a lack of resources, and that can be financial resources and other things that really prevent people from accessing adequate food. Hunger is different because hunger really is just kind of a personal, physical sensation, sometimes a discomfort that's caused from not eating food, a prolonged lack of food. So hunger is really a potential consequence of food insecurity.
Is food insecurity always temporary?
So, it really depends. I mean, some people can experience temporary food insecurity. That would be just a short-term lack of sufficient food, and that may be for a lot of reasons. It could be a sudden change to your income. Maybe you got laid off, lost your job. It could also be because something else is taking your money, your budget, and, maybe a medical emergency or a major home repair, that suddenly results in your inability to get sufficient food. People who experience temporary food insecurity usually will regain access to adequate food, but they've got a higher risk of becoming insecure again in the future. People who have chronic food insecurity, which is really a long-term lack of that access to good, healthy foods for an extended period of time, that's usually related to poverty, sometimes homelessness. And it's much more difficult to recover from chronic food insecurity, and it's associated with a much higher risk of health complications as well.
So you got causes for food insecurity?
Yeah, I mean, it's really a complex issue, and there's not a single cause that you can pin on food insecurity. So there's a lot of factors that go into it. I mean, one of the biggest factors absolutely is income. And, in 2020, looking at some studies, about 30% of low-income households were food insecure. And that compares to the national average, which is really around 10%, a little bit higher than 10% across the country. But then location can actually affect food security as well. There's unfortunately a lot of areas throughout the country where people can't access, full-service supermarkets and grocery stores, and so they can't actually buy or obtain fresh foods, produce. Those are areas we call food deserts. You've probably heard that term a lot because we bring it up a lot of times after hurricanes. In particular after Hurricane Katrina and a lot of the other more recent hurricanes, even major areas in New Orleans were food deserts where really we didn't have the transportation to get to the grocery store that was open so that we could actually buy the food we need to eat.
I would imagine inflation has impacted this as well.
Yeah, absolutely. Inflation plays a huge role, and this year, it's increased the cost of pretty much everything we buy, but in particular, your grocery bill's gone up tremendously, and that's on everything, meats and fresh produce and dairy. I mean, the fortunate thing is inflation's slowing down right now. Prices are still higher than they were a year ago, and so a lot of people are not able to purchase some of the nutritious foods that they could before inflation started going up. And, the other problem right now, there were a lot of social safety nets in place during the pandemic, and a lot of those have sunset. They're no longer around, so there's not as much extra aid that there was just a couple of months ago.
Quick break. We come back. We're talking with Dr. B, Chief Medical Officer of People's Health, about food insecurity as we approach Thanksgiving. According to Feeding Louisiana, roughly 1 in 5 people experience food insecurity. When we come back, we'll talk about how it affects health and who is most impacted by it. Right now, it's time for traffic on WWL. 8:25, Tommy Tucker, WWL. Quickly back. You awake, Dr. B? Tim wanted to make sure you were awake. You all right?
I am, definitely.
Okay, good. You might want to see a doctor about your ears. Dr. B, Chief Medical Officer at People's Health. We're talking about food insecurity. How does food insecurity affect health, Doctor?
Yeah, hunger and health are definitely connected, and adults who are food insecure are much more likely to develop a lot of chronic conditions, things like diabetes and depression, even heart disease. And but in addition, they really also can have a lot more medical and surgical complications. In particular, they can have longer hospital stays if they do end up in the hospital because diet is directly linked to healing times. And so if you have a bad diet, you're going to heal less quickly.
Is there a group that's more impacted by food insecurity than others?
Yeah, absolutely. I mean, older adults definitely have higher rates of food insecurity. And, about 1 in 4 Louisiana seniors actually have food insecurity. And that has a lot of consequences. They're really, older adults are susceptible to negative health outcomes. And, about 65% of those with food insecurity could have diabetes. They could develop things like congestive heart failure, high blood pressure, even gum and tooth disease. And, other groups that we worry about as well, people of color certainly have higher food insecurity, as well as people with disabilities or people with chronic health conditions.
How is People's Health combating hunger this holiday season, Doc?
Well, we serve over 90,000 members across Louisiana, and most of those members are 65 or older. And so, we're really in tune with and understand the challenges that older adults have, especially during the holiday season. This can be a tough time of year for a lot of people. So what we do is we partner with Second Harvest Food Bank every year. We try to bring, Thanksgiving meals to local seniors, and our employees have really volunteered every holiday season since 2012 to help prepare, package, and deliver homemade meals to those seniors. And so this year we actually hosted 2 big community meals in collaboration with Second Harvest, as well as the Councils on Aging in Terrebonne, St. Mary, Tangipahoa, and in Orleans. And those events really provide nutritious meals for seniors, but in addition, during the holidays, it can be a very lonely time of year, so it gives the seniors a chance to socialize with each other as well. So it's very rewarding.
How can other people help combat hunger?
Well, if you're in New Orleans or the Lafayette area where Second Harvest is located, you can definitely volunteer with them. Best place to go is no-hunger.org and see all the opportunities. They've got a lot of need for people to help in sorting and packaging donations, helping to prepare meals, or even deliver the food to seniors. But another thing to keep in mind this time of year is really giving. Your food banks really need help right now, and so they'll take donations. You should go check and see what they're looking for, what their guidelines are. There's a lot of highly requested items they may be looking for, and some of them will take money as well. And, so keep out for a lot of keep your eyes open for a lot of things going on in the community this time of year. There's a lot of neat projects. There's grocery shopping for a senior, because they can't get to the grocery store. You can help stock a community refrigerator. We actually have some wonderful community gardens in the area, and you can donate supplies to them or donate food to schools. We have a lot of food insecurity in our children as well, so that's another area you can help.
And if somebody's listening right now and they are experiencing food insecurity?
Yeah, absolutely. The best thing to do is call the National Hunger Hotline. It's very easy, 866-3-HUNGRY. Is what you should call, and a representative there can help you find all the local resources. They can tell you where you can get meals, they can tell you where you can get food, but they can also often connect you with government assistance programs.
Thank you, Dr. B, for all your efforts in people's health. We will talk to you next week. I hope you have a great Thanksgiving.
Thanks, Tommy. You too. Don't eat too much.
I'll try not to, but no promises.
Me too.
All right. To find out more about People's Health, you can go to peopleshealth.com. You can visit that People's Health Medicare Center, 3017 Vets in Metairie, next to Party City. Appointments are recommended. Walk-ins are welcome, too. You can call 800-978-9765, or you can follow People's Health on Facebook, Twitter, and Instagram. Right now, it's time for WWL First News. For that, we go to Ian Ozan.